The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
With so many people living longer, the fear of outliving your money becomes a reality for many of us. Will I be a financial burden? Will I outlive my money? How will I be remembered? My name is Neil Himmelstein, president of Main Street Planning Group. Please contact me by visiting mainstreetplanninggroup.com. That's mainstreetplanninggroup.com, or call 631-647-4694. I will introduce you to strategies that will guarantee you will not outlive your money, that can guarantee you will not be a burden on your loved ones. Through a collaborative approach, we will uncover solutions that offer tax-efficient strategies, lifetime income, and legacy planning, choice, organization, direction, and education. That is the code we stand behind. Contact mainstreetplanninggroup.com. That's mainstreetplanninggroup.com, or call 631-647-4694. And listen to me every Friday at 3 p.m. as I host the Main Street Code for Financial Success, right here on 103.9 LI News Radio. Good afternoon. Welcome to the Main Street Code for Financial Success. I'm your host, Neil Himmelstein. I'm here every Friday at 3 o'clock. And when we talk about our code, we talk about choice, organization, direction, and education. And we help hundreds of advisors across the United States in the areas of long-term care, life insurance, disability, annuities, and life settlements. And we also are very good at helping you put a team together for your plans, whether you're near retirement or past retirement or trying to save for retirement, and you don't have an attorney or an accountant. We're happy to put all those things together so that your plan, you have a team for you and you're working. And one of my financial partners and team members we have with us today, Mr. Bob Falkowitz. Say hello.
Good morning, all.
Bob is good to have you, Bob. Bob is a specialist in Medicare planning and Medicare insurance. And Bob, if you could just kind of briefly tell us a little bit about yourself and about, why you got into Medicare and what you're doing there.
Okay. So I've been in the world of health insurance, especially group health insurance, about 2 or more decades. And knowing the arena of how health insurance work on the group side, about 10 years ago, I was sitting with a law firm reviewing all their medical, and we had senior partners there over 65, and I'm saying, well, you have Medicare, you're on this great health insurance plan through your company, and you could actually look into, because attorneys don't retire at 65, considering full Medicare and removing yourself from the group health plan to save some few dollars, because very basically, Medicare is one of the best, if not the best, health insurance to have on the street. Doctors enhance Medicare because they don't have hassles with Medicare questioning their orders for any kind of service, unless it has to do with plastic surgery, cosmetic surgery, I should say. But the Medicare arena is very exciting. Been involved with it many, many years, and every day someone's turning 65.
Right.
And there's more to the Medicare arena, too. Neil, I'm sure you're going to ask me more questions about Medicare, but no 2 people come to Medicare with the same needs.
Right. So you just brought up a very interesting point that I run into quite frequently. Somebody's employed, and they have it at work, and they have their health insurance at work, and they have to at least, do they have to register when they turn 65? How does that all work? I mean...
Okay, so you're turning 65, you work for this company, and what do? You're Part A and Part B Medicare. So the general rule, that the federal guideline rule, if someone works for a company that employs more than 20 full-time employees, 20 full-time employees, they could waive off the Part B Medicare, because that's the cost of Medicare, Part B. It's based on your household income. For those who are work for a company under 20 full-time employee, Medicare is your primary coverage. So you need to take the Medicare, sign up for it then. Some carriers do remind you, others don't, but if you don't take your Medicare and a claim goes in, the carrier could say, we're only responsible for 20% of that medical bill, because Medicare is the primary carrier. On the A side of Medicaid, hospitalization well, Medicare would be.
Whoa. Go backwards. I'm sorry. I'm a little slow today. So I'm working for a company, and my company's got a great health plan, and I don't apply for Medicare. Maybe it's a small company. Maybe it's 3 people. Maybe it's a law office, like you said, and I don't apply for Medicare. Am I still okay?
No, as long as the company, if this company has less than 20 full-time employees,
yes,
you should definitely apply for Medicare, because Medicare, even though you're on a group health plan, is the primary coverage. Okay, they coordinate your Oxford. Say if the plan is Oxford would be second to Medicare on any claims coming in. All right. So Medicare is primary, your company plan would be secondary. And the reason that people look in and want to do Medicare, because if they are cost sharing with their employer for the cost of insurance, Medicare 9 times out of 10 comes out less expensive than staying on the group health plan.
Gotcha. So anybody that has a company or is working for a company and you're turning 65, it's a big cost savings to you and your company and to the individual to apply for Medicare. Now, when does somebody...
Not only the cost saving, but the mandatory limits because of that law with the federal government.
Right.
If you do work for a small company, Medicare is your primary coverage.
Okay.
And your group health plan is second to Medicare.
Gotcha. That makes sense. So
if you work for a large company, it's reversed. The group health is primary and Medicare is secondary.
That's really crazy that they have different rules. And that's why we have experts like you, Bob, I got to tell you, because these rules are, you get caught up wrong in these rules and bad things can happen. Like think you're covered and you're not covered, or you're not covered properly, or it's expensive, or you can't get to the doctors you want to. There's all kinds of things that could happen. But Bob, let me ask you this. At what age do you apply for Medicare specifically?
Okay, the rule of thumb, and this is a standard, for someone who's turning 65, the rule of thumb, you could apply 3 months before the month of and 3 months after your 65th birthday.
Okay.
Okay? But there's exceptions to rule 2. People who have Lou Gehrig's disease or end-stage renal on a list for a kidney transplant can apply for Medicare, early Medicare.
No matter what age?
No matter what age. And the same thing for people who are on disability, Social Security disability income for 2 years or more. For 2 years or more, can also apply for Medicare.
Oh, did not know that. That's good to know. And what happens if you miss your enrollment window?
This could be a late penalty for enrolling later on, like after that 6-month window, and there's a look back. So yes, there is a penalty for enrolling later on, and most people know, especially if you're working for a small company and you're on their group health insurance, sometimes the carriers let you know, you're 65, you should be registering for Medicare.
Okay. Now, there's different parts of Medicare. There's the Medicare Part A, which is basic hospital. You can go into that. And then there's B and D. Can you just tell me what these parts are, what the difference is, and how that works?
Neil, actually, there are a few more letters, but we'll stop
there. All right. Well, there's an alphabet. So this is why it's confusing. This is why I have you on the show, because guess what? It's not so simple. You need people like yourself to guide you through this whole process.
It's not. When I started getting into this, I said, my God, Medicare is really a puzzle. And it really is. You're putting pieces of puzzles together. But anyways, there are 4 major letters to Medicare. A, Part A Medicare, Part B, Part C, and then Part D. I'll go into the 2 last letters, C and D, later, but let's talk about A. Part A Medicare is hospitalization, institutional care. So anything to do with hospital admission, skilled nursing facility, and even hospice care is under Part A of Medicare. Part A Medicare, you're going to ask me, how much does that cost? Well, as long as you worked 40 quarters or 10 years, Part A Medicare is free when you turn 65 because you paid in on your Medicare tax while you were working, the years working. The next the next letter is Part B Medicare. Part B Medicare is everything else. Doctor's office visits, outpatient services, outpatient surgical, radiology, x-ray, laboratory, chiropractor, physical therapist, everything other than institutional, in-care institutional is Part B Medicare.
Interesting.
Okay?
Gotcha. So we got to A and B. We're going to get to some of the rest of the alphabet right after our break. You're listening to the Main Street Code for Financial Success. Best way to reach me is 631-647-4694. And Bob, if someone wants to get a hold of you and ask you questions about Medicare, what's the best way to get in touch with you?
My best phone number to call me would be 516-220-7849, or quickly email bob@seniorcareconsultant.net.
Fantastic. And we're going to be right back after the break, and we're going to talk about some of those other letters besides A and B. Thank you. Welcome back, everybody. You're listening to the Main Street Code for Financial Success. I'm your host, Neil Himmelstein. I'm here every Friday at 3, and with me is Bob Falkowitz from Senior... What's the name of your company, Bob?
Senior Care Consultant.
From Senior Care Consultants, and Bob has honed his career and is an expert in the areas of Medicare insurance and other health insurance, but he's really, for the last several years, really been a crucial partner in explaining Medicare to my clients and giving them options. I think having options is the key. And before the break, we talked about the Medicare Part A, the basic part. We were just getting into Medicare B, and then we want to talk about some of that a little bit, Bob. So let's go a little bit more into Medicare Part B, what that is, and we could talk about IRMAA, we could talk about prescription drugs and everything else. But let's go to Medicare B.
So Medicare Part B is the big part of Medicare. That's saying it covers your doctor visits, your laboratory, your x-rays, chiropractors, physical therapy, everything that's non-institutional, or even a day surgical procedure would be under the Part B side, seeing a doctor at a facility. But this is all about non-institutional healthcare needs. And Part B does not come for free. There's a cost to it.
Okay.
Part B Medicare, that most people are unaware of. They think when you're on Medicare, it's zero cost to you. Not true. Medicare Part B is based on your household income. And there are like 7 different brackets, if I'm correct. And the lowest bracket for Part B Medicare for 2026 will cost an individual $206.50 a month if their income jointly tax return is under $218,000.
Right. And then it goes all the way up to...
So people at the top end of income earners, $750,000 for married, and those above $500,000 who are single, their monthly cost for Part B Medicare would be $702.10, plus an IRMAA tax, which I'll go into a little later. But you see, Medicare, as your income goes up, so does the cost of Medicare goes up, and these are monthly rates.
Right. So
what it is...
So that's very important, Bob. So when we're doing planning with people, when you take your retirement income, when you're taking your 401k income, if you're retired or if you're not retired, definitely affects the cost of your Medicare Part B. Is that what I'm hearing?
Sure, because what it is, okay, this is how it is. The government goes back 2 years, so we're in 2026. So anybody who is applying for Medicare now, they look at your 2024 tax return. So even though you might have retired in 2025, they're still looking at what you earned in 2024.
Gotcha. That's how they make the determination.
Right.
So based on that is how much you get taxed on the Part B, and then there's this thing called IRMAA. Right.
Income-related adjustment. They call it IRMAA, and really it was to also offset. This piece is to offset the cost of Obamacare.
Okay.
So that's how they got into it through the government. So someone who's at the base level of jointly $218,000 or single $109,000, they pay zero IRMAA tax income. But someone at the top end, remember that $750,000 top end, their IRMAA monthly adjustment would be $85 and change.
Gotcha. So that
on
gets
top of that
added
$700
to the Part B stuff. So these things are, when we're doing long-term planning, things to consider about, especially if you're taking income out. And we talk about spending plans, and long-term income from life insurance, which is tax-free, is not considered part of your IRMAA, not considered. Anything that you take out of IRAs or 401ks is considered income, and if you're making additional income and you're taking out those things, that can affect how much you have to pay for this Part B and IRMAA. Now, why do people buy supplements after they have A and B? Why do I have to get something additional to that?
Because Medicare is not insulated that there's zero cost out of your pocket. And if we're going to go into supplemental, I'll give you an example. Such as if you're admitted to the hospital tomorrow and you have Part A Medicare, your hospital cost, admission fee, is $1,736. That would be your out-of-pocket cost for being admitted to the hospital. The first 60 days are covered in full by Medicare. But from the 81st day to the 90th day, you, the patient, will pay $434 per day. And then there's another level. From the 91st day to the 60th day, you pay $868 per day. I mean, higher than likely you're going to be in the hospital that long, but it could happen. This is why people like supplemental plans. If you buy a supplemental plan, that picks up your out-of-pocket amount. So that $1,700 admission fee in the hospital, supplemental carrier pays that on the A side of Medicare.
That doesn't even include doctors that's the A side. But that's the A side. Remember Part A, the hospital side? Right.
Now let's talk the Part B side of Medicare and supplemental. So the Part B side of Medicare, everybody who has a Medicare plan has a annual, this year it's $283 deductible before Medicare pays the doctor a dime. Okay, Medicare contracts with doctors at 80%, but only reimburses them 60%. So there's a balanced amount of 20% that if you did not have your supplemental plan, you're going to pay the full amount, that 20% to the doctor, all right? If you have a Medicare supplemental plan, that will pick up that dollar, the difference, everything that Medicare does not pay the doctor, the supplemental plan will. So they'll pick up that 20%, including some of the plans, because every plan is different with supplemental, including that $283 Part B deductible.
Okay. So we can talk about Advantage plans and supplemental plans in addition to Medicare A and B. Let's talk about that at another time.
Well, I think we should throw in right now, Neil, because we talked about the letter A and the letter B on Medicare letters.
Right.
Now there's that letter C, which people don't know. What does letter C stand for? Letter C stands for that Medicare Advantage plan.
Okay.
So Medicare Part C is different. And why is it different? You're giving it to private carriers to become your Medicare provider, such as you hear it on the news every
right, on the advertisements
every October and November, the open enrollment season, and there are dozens of carriers out there. So carriers have to give you the same basic coverage that traditional Medicare gives you, Part A and Part B, but it could also give you extra benefits such as vision and dental, and even food at home after coming out of a hospital.
That's the Advantage plan. That's with a C plan.
That's the Advantage plan.
Right. Okay.
Most of the Advantage plans are health maintenance organizations, so the carrier has more input into your type of medical needs and services you're going to get, and they could also question the doctor, is this procedure necessary, and ask for a pre-authorization.
Right.
Okay? But here is the true difference between an Advantage plan and traditional red, white, and blue Medicare card, going with the government Medicare. It's about the service area. With true Medicare, all you have to do is say, doctor, you take Medicare, you go. Don't even need a referral. Anywhere in the country, 99% of all hospitals take Medicare, okay?
Right.
When you look at a Medicare Advantage plan, it's more domicile to where you live and your providers in the network. Because, again, it's based on a health maintenance organization. So someone in New York And if they, travel a lot and it's not an emergency, because emergency, no matter what coverage you have, even in group health insurance, if you go in an emergency room anywhere in the country and it's a true emergency, it's covered by the carrier that you have, okay? But if you travel a lot and you have a Medicare Advantage plan, you have to make sure that you're going to get coverage out of state.
Bob, we're running out of time, everybody. I'm sorry to say that, but Bob, this is so intricate and so detailed. You so need to talk to Bob if you're considering Medicare and you're considering your options. Bob, what's the best way to get a hold of you?
Again, email would be bob@seniorcareconsultant.net without the S, just consultant. And phone number 516-220-7849. And the last letter is Part D, Medicare prescription drug coverage, another discussion.
You got it. Fantastic. Thank you, Bob. I really appreciate you. And if you want to get a hold of me, the best way to get a hold of me, Neil Himmelstein, 631-647-4699.